group.
Well, hello. Hi, all of you at LA Elderly. I see we have a few people watching. We're all learning more about tech. That's going to be another positive thing that comes out of all of this. I'm so excited that we can do our first LA Elderly Live, and we're here with Stefanie Elkins. I met Stefanie about a year ago, as I shared last time. She is an expert on advanced care directives. She's Stefanie with an F, not a PH. We want to make sure we do that.
The things we learn.
We're going to go back and forth, but really Stefanie's the expert, and she's here to share a bunch of information for us. So before we start talking about advanced care directives, a couple of things. If you want to hit like, or you want to pop a question in the comment section, I will try and work this out and ask questions of Stefanie. So first of all, Stefanie, tell us a little bit about how you even came to this point to want to, even interact and do this stuff with the elderly and deal with death, and tell us what your passion is and how things have come to your way. Stefanie, can you hear me? We lost your audio, Stefanie. Your mic is off. I'm going to unmute.
I was getting a little feedback.
Okay.
But now I'm frozen.
Tell us how you got to your point.
So I see that myself frozen on screen right now, but that's fine. Hi. Okay. So I've always worked in nonprofit and the elder care field. Yes. Let me see here.
Go ahead. Tell us about it.
Okay. It's very delayed. I'm hearing feedback of myself.
Turn the other part off and just talk to me.
Okay. There we go. Hi, everybody. Sorry about that. I was hoping to have you on Facebook Live so I can see who's checking us out, but I'm better just to stay on one platform at a time. So I've first of working with elder care and aging field is when I was in high school, junior high and high school. And my mom worked as an activity specialist in a older adult assisted living facility. And so she brought games and did activities with individuals. So I was the bingo caller with her a while ago. And then from there, I've always been involved in wanting to serve, help individuals and others. And I was always drawn working with older adults. And now it's even beyond that, because some of the conversations I'm involved is for everybody. But for 8.5 years, I ran a free resource and support center for family caregivers dealing with Alzheimer's and other memory impairment. And I know we really resonate on that information. And then with those conversations and holding space for others on all topics related to caregiving, working with individuals with dementia, chronic illness, and so on. What are the resources? What are the tools to educate, empower, and energize individuals? And from that, I focused more and really wanted to hold more space at end of life around palliative hospice care. And so for me now, and over the last 15 years, really wanting to get this conversation out forward, not just when you have a diagnosis. And today is the perfect day for us to be talking, Michelle.
So why is today the perfect day?
Today is National Healthcare Decision Day. Since 2007, I believe, it's been a national declaration day of National Healthcare Decision Day that I are in charge of our own healthcare decisions. It's not defaulted. We need to be having frank conversations about the care we want or don't want at end of life. And that needs to start now, and how we want to live and how we want to die. And at this time of COVID-19 and us kind of really reflecting on what's important to us, along with National Healthcare Decision Day, we should do it. And it's always interesting because Benjamin Franklin has this, quote, the only thing we can, I'm paraphrasing, the only thing we can count on is death and taxes, right? Taxes have been postponed a little bit. We still have to pay it. But the idea of death, and taking that away and just having really honest conversations, even though we fear it.
Yeah. So advanced care directives, big word. Sometimes it doesn't even come into the vocabulary
Oh,
until
yeah.
somebody's elderly. Tell us about it, your thoughts.
So this is my perspective and how we view it. And the reason why we don't hear about advanced healthcare directives is because nobody's really in charge of it. You know, who's supposed to have this conversation? The only time you usually have it is when there's a diagnosis or you're caring for somebody else, like an aging parent, which for a lot of us, we're there now. So I like to look at it, there's what we call a comprehensive estate plan. And this is about advanced care planning, not just about this directive. Mm-hmm. So if you look at a comprehensive estate plan, you have a will, trust, power of attorney for finances,
Sure.
an advanced healthcare directive,
okay.
Right? We're here to talk about the healthcare directive specifically. Some people call that a living will. Every state, it's a little different. But there's certain basic components of that directive.
So that's
how I frame it, but it's about the idea of the care you want or don't want. And there's like 6 major parts of an advanced healthcare directive.
So tell us about them. What are the parts? So
first of all, sometimes the only time you'll ever hear about advanced healthcare directives is you're talking with a lawyer or in your doctor's office. I've talked to a lot of people that work in this space. The conversation usually doesn't come up unless you bring it up, right? The care you don't or don't want. Right now, in 2016, there is now a code, Medicare code, to encourage older adults, if you're on Medicare, to have caring conversations, advanced healthcare directive conversations. It's billable now. So there is a code for that to start beginning these conversations. Some healthcare systems are better now in terms of trying to engage people to have these conversations earlier. What are we really talking about here? The major components of advanced healthcare directive is, who do you want to be your decision maker if you cannot speak for yourself? So whenever you look at an advanced healthcare directive, you always look at it from where you're sitting and what ailments or what, in terms of diagnosis or treatments, where you're at right now. If you're healthy, compromised, wherever it is, that's where you start looking at. And this is not a stagnant thing. This is something that you constantly update at different times in your life. All right. You don't have to be a senior. It starts at 18, right? One of the things on the advanced healthcare directives, if you want to be an organ donor, guess what? When do we fill out? When are we going to be an organ donor? When we turn 16 and we get our driver's license and it asks us. All right. So that's where your advanced healthcare directive starts, is making that call. So, but going back to one of the major questions that we talk about is, who do you want to speak for you when you can't speak for yourself? And this is a lofty decision. In some places it's called a decision maker, your agent, your healthcare proxy, your surrogate. These are all different terminologies you might hear. But really it's about, who do you trust to make those calls for the care you want or don't want at end of life?
Question for you.
What?
Question for you. So, yes. And then we'll talk about how this all plays out, maybe with everything that's going on with COVID-19. But, I would assume that many people, not all, pick a family member. Is it ever a thing where more than one family member is named for this? If you've got 6 children, do you, I think, roll the dice, or what do you do?
The co-agents, you can have co-agents be it, but that's not always. Sometimes for a lot of family dynamics and grief, which are the 2 major things that I deal with, sometimes it's better to have one voice, be able to be the decision maker, talking with medical professionals, having that voice. So a lot of times it's maybe default to if there's a healthcare professional in your family, sometimes not, but it's really about, who do you think is going to be assertive, be your advocate with the doctors, because this is a team approach. So you're going to want somebody that geographically is usually an issue that somebody might decide on one person. It's assertiveness. It's knowing that they'll be able to, if you want to live or die a certain way, that somebody's going to be able to make that call to honor your wishes.
And how
And
does
I just want to add, so I think that's a good question. The other question is, if you do not have an advanced healthcare directive, what's the default?
Mm.
The default is kind of a next of kin.
Oh, okay.
So it is by relatable status. Marriage, if you're married to somebody, a spouse,
Okay.
kids, parents, siblings. That is a default in California. If there's a lawyer out there, but that's really the default. So a lot of people have family of choice now.
True.
It's not a family member that knows this individual best.
Got it.
And so that's why it's very important at this aspect for people to have advanced healthcare directives, because for those people to make their decisions if you can't talk for yourself, and also after you die in terms of disposition.
So how does a do not resuscitate order interact with
So we're moving now to a different place. So the first area of advanced healthcare director is choosing your decision maker. And the next one is what kind of treatments sustaining your healthcare that you want or don't want. And depending on the advanced healthcare directive, it's like prolong life and do not prolong life. And there's a lot in between that of what kind of life-sustaining treatments that you will want between there. DNR, do not resuscitate, is one of them. CPR is one of them. Being on a ventilator, artificial food and nutrition, blood transfusions.
What
all
about
these
the
are
POLST?
Specifics. What
about the POLST?
So once again, you're bringing up something good. So let me just diversify between those two things, because you jumped ahead to DNR.
Got it.
So for advanced healthcare directive, the two biggest places where everybody should have, you need to define your agent, identify your agent and let them know. And then the kind of care you do or don't want for advanced healthcare directive. Now with DNR, which is more specific, usually is for those that maybe already have a terminal illness.
Okay.
That are a certain stage in their life. And that's where you might be familiar with the POLST, or most in certain states, which is a physician order life-sustaining treatment form. It's hot pink here in California. It's most in other states. Nurse practitioners can also fill it out. So especially during these times with vulnerable populations and individuals, POLST is not in place of everybody should have an advanced healthcare directive. With the POLST, it's more, the guideline for that is if you have a terminal illness and if there's a feeling that you might die within the next year. Those are the guideline factors. So if you move into assisted living, you shouldn't automatically have a POLST.
Got it.
But within there, it can be more specific for do not resuscitate and other things, treatment you do or don't want. So that is for the vulnerable populations. And if you do not want to go to hospital, if you're one of those individuals that are vulnerable and do not resuscitate, the conversation right now should be with your doctor about this POLST form and also hospice, because that is medical care you get in the home.
Got it.
If you do not want to go to the hospital and you do not want to be resuscitated but get medical care, that is a conversation for hospice.
All right. Thank you.
And that's the same thing with the terminal and at that point.
That's perfect. I'm going to pause. I'm going to restate that we're doing advanced care directives with Stefanie Elkins right now. It is our first live. I know there's a little couple of issues, but she's really kind of walking people through to think about these things. So here's my next question for you.
Okay.
You're so
ready for you.
And I want to make sure that we put later on a way for everyone to contact you if they want to
beautiful
conversations. We'll put that in the comment section. Before we get there, what advice would you give to people that are feeling, squeamish, or I don't want to think about this now, or this is a drag and it's too heavy? What advice would you give people?
So understandable. It's not a comfortable topic, but it is a gift to have these conversations. It's less of a burden than not more of a burden to have these conversations with your family. It doesn't have to be a big sit down. We are living in a world right now. I usually say like, oh, the conversation can kind of mildly come up when you're watching a movie or you see a documentary or book or family, somebody you know dies. That's when the kind of like, oh, I wouldn't want that to happen to me or not. We're living in a time right now where it's an opportunity, even though sad, that we're talking about death and dying away, knowing, guess what? It happens. And so I think it's an opportunity to have this discussion, a conversation. This is ongoing. It's not a one-time thing. So so that's really, it's not, it doesn't have to be a big sit down. It could just be, who do you want to have your agent, or these ongoing little conversations of really what's important to you.
Right. No, I think you bring up good points. Another question for you.
Yes.
Is this the type of document? A lot of people will also think, I'm spending a lot of money on these documents. Can I just write up or type up something on my own, or does a lawyer have to do it, or does it have to be filed? What advice there?
So one of the other things with the Advanced Healthcare Directive, right, is it does not need to be notarized.
Okay.
Okay. There's a lot of different models of advanced healthcare directives. I have like 5 or 6 right now that I love for different reasons. Depending, for me, it's like finding the right advanced healthcare directive to fit the person. Usually start and finding out, does your healthcare system have one? Work within what your own community has. So that's the first thing I would ask, is if they have one. Now,
community, do you mean like your insurance or your doctor?
Kaiser, Providence, UCLA, all has sites, but they're just not proactive necessarily in sharing it unless there's a diagnosis and then the conversation starts. So now we're starting this a little sooner.
Got it. Okay. So you can actually ask your doctor and they can help guide you.
Oh yeah. And like Kaiser, right, they have a geriatric social worker that sits in the middle there. That's part of their conversation.
Got it.
So, but I have, within different healthcare systems, they're changing their ways as we're moving to this patient-centered shared decision-making model of knowing it. Usually we're not asked these questions unless we're going in for surgery. That's not the right time.
Right. We're
trying to figure out better ways to do it. There's more people like me working in this space to encourage the conversation usually in, shopping lines. Not right now. We're not talking to our neighbors in the shopping lines, but, that kind of stuff. So going back to the Advanced Healthcare Directive, you need to have, these are just going back to what's necessary on it. You need 2 witnesses. One cannot be, they can't be your agent or your decision maker that you chose as your agent. It can't be your doctor. And if you're in a skilled nursing facility or a facility, it can't be anybody that works there.
Okay.
There are models out there that I like. Some are more detailed than others. And that's why I necessarily would encourage people to go work with organizations that have value worksheets that really gets more specific into what people want or don't want. It's just getting clarity. You can do one on your own in a napkin and date it and sign it and throw it in there, but there is enough good stuff out there that clarifies what you want and you don't want. And I can give some of those, like I said, I'm working right now with the Conversation Project. I'm one of their champions. I work for Compassionate Choices. They have great resources. Stanford Letter Project, Prepare to Care, which is based at the 5th grade reading level. So there's different languages. So there's a lot of great tools. It can be overwhelming. But that's why I start with your healthcare system, see what they have. If it's part of an elder, if you have an estate lawyer, elder law, I want you to have the right conversations to get as specific as you want, because that's where people get confused. Because sometimes you don't know. You can be in a trial period for the care you want or don't want, but you don't get as specific enough.
Right. Excellent guidance. So one more question for you before we wrap this one up. We're dealing with very uncertain times now, and we're dealing with COVID-19, and it is really hitting the senior population, the elderly, particularly those in skilled nursing facilities, very, very hard. There is good things coming out of it. People do often have mild cases and all that kind of good stuff. Any additional advice based on that you want to share?
So there was a couple things that just came up earlier today. I mean, it is hard right now. People want to be with family, especially during these times. And that's hard because we don't get that touch, that need to connect. We have Zoom. Telehealth has taken off.
Yes.
Right. National Hospice and Palliative Care Association with other organizations have gotten telehealth in locations. So that is the first thing that you ask about. Palliative care. If you're inpatient, outpatient, whatever healthcare system you have, ask if there's a palliative care department or team, if you will. If it's a doctor, nurse, social worker, chaplain, those are the healthcare individuals that will be there, will be the advocate and the voice. Telehealth, palliative care, Zoom, are, I think, the other connection points that we have right now.
Excellent, excellent advice. Look, Stefanie, this was great. I hope we can do this again on another topic. Everybody, we're going to put Stefanie's information in the comments below. Again, thanks for bearing with us. It was my first Facebook Live for LA Elderly, and a very important topic. And I'll end with this,
Yes.
just to support what Stefanie says. You know, as I went through my journey, because we all know that LA Elderly is in memory and tribute to my mother, who passed away 2 years ago, had some dementia, and it was a 10-year sort of road that we went on. But when it came time, and she was very good about paperwork, so I always knew where the paperwork was.
Gift.
And there was paperwork I had touched, and towards the time we put her in hospice, I pulled the Advanced Care Directive. And I have to tell you, as I've told many of my friends, there was zero question what you wanted. Just zero question what you wanted. And it was just really clear to me. And it helped me make the decisions that I need to make, which were not easy. It's not an easy road for anybody, but I still to this day thank her for doing all that paperwork, the financial, the health, the everything, was done.
Do you know who did that with her? Do you know how,
Yeah, it was all done through a lawyer. We have a very good family lawyer.
Okay.
We are one of those families. And it was a real gift. It was a real gift I got. So again, everybody be safe, be well. Thanks for hanging in. If you haven't watched this live, there were people that poked in and out. Please take some time and watch it, about 20 minutes. I will get my interviewing skills down a little bit as we go. And Stefanie was just great. She's full of knowledge. And I want to wish everybody a wonderful day, and take care of yourselves and take care of each other.
Much gratitude. Thank you.
Bye-bye. Thank you very much.